Pharmacology is defined as the study of substances that interact with living systems through chemical processes, especially by binding to regulatory molecules and activating or inhibiting normal body process. We know that depression is one of the most common psychological disorders. This presentation provides an overview of drugs used in depression and mania. The symptoms of depression, we have the feelings of sadness and hopelessness, inability to experience pleasure in usual activities, changes in sleep pattern and appetite, loss of energy, and suicidal thoughts. Mania is characterized by opposite behaviors such as enthusiasm, anger, rapid thought and speech pattern, extreme self-confidence, and impaired judgment. Most clinically antidepressant drugs potentiate the actions of norepinephrine and serotonin in the brain, which led the biogenic amine theory is proposes the depression is due to the deficiency of monoamines. Conversely, the theory proposes that mania is caused by overproduction of these neurotransmitters. In this area, we have the summary of antidepressant drugs. For selective serotonin reuptake inhibitors, it inhibits the reuptake having 300 to 3,000-fold greater selectivity for the serotonin transporter compared to the norepinephrine transporter. It contrasts with tricyclic antidepressant and serotonin norepinephrine reuptake inhibitors that non-selectively inhibit the reuptake of norepinephrine and serotonin. It has a little blocking activity in the muscarinic, alpha-adrenergic, histaminic, and H1 receptors. It has a common side effects associated with disease, such as orthostatic hypotension, sedation, dry mouth, and blurred vision, with drug of choice in treating depression, which includes fluoxetine, citalopram, escitalopram, fluvoxamine, paroxetine, and sertraline. It takes at least 2 weeks to produce significant improvement in the mode, and maximum benefit may require up to 12 weeks or more. Its therapeutic uses are the following, with 2 to 8 hours peak levels pharmacokinetics, 16 to 30 and 36 hours plasma half-lives, and metabolized by CYP450. For serotonin norepinephrine reuptake inhibitor, it inhibits the reuptake of both serotonin and norepinephrine, which includes the venlafaxine, desvenlafaxine, levomirdazepam, and duloxetine. For atypical antidepressants such as the bupropion, mirtazapine, nevazodone and trazodone, dilazodone, vortioxetine are the mixed group of agents that have actions at several different sites. For tricyclic antidepressants, it is a potent inhibitor of neuronal reuptake of norepinephrine and serotonin. It also blocks serotonergic and alpha-adrenergic histaminic and muscarinic receptor, which includes the tertiary amines and the secondary amines. For monoamine oxidase inhibitors, it inhibits not only MAO in the brain but also MAO in the liver and gut that catalyzes the oxidative deamination of drugs and potentially toxic substances, which includes the phenelcine, tranylcypromine, isocarboxacid, and the selegiline. It also inactivates the enzymes permitting neurotransmitter to escape degradation and accumulate within the synaptic neuron and leak into the synaptic space. Lastly, for the treatment of mania and bipolar disorder, we have the lithium salts, which is renally eliminated with the other drugs for mood stabilizer, for bipolar disorder, and for mania, and for bipolar depressions. That is my presentation, and thank you for watching.